you are someone who has struggled with sciatica for any amount of time, you understand how frustrating that can be for moving around, living throughout your day, and even performing in the gym. And this video is dedicated to 3 of the top things that I use to deal with my sciatica to make sure that I'm living the best life I can and perform well in the gym. What's up, everybody? Welcome back to another episode of Excellence in Motion. My name is Caden Sloan, and I am here to inspire you to achieve your potential through movement. If you're new to the channel, I make videos on gear reviews, health education, and movement tips, just like this one. If that stuff interests you, make sure you hit that subscribe button and hit that little bell for notifications to make sure that you're notified every single week when a new video uploads. So before we dive into the top 3 movements that I use to deal with my sciatica, we need to understand what sciatica is. For the most part, sciatica is a pretty broad, sort of almost garbage term at this point for nonspecific low back pain that sometimes radiates into the lower extremities. An anatomy lesson for everybody: our sciatic nerve is one of the biggest nerves in the body, and it runs right down through the glutes and all the way through to the bottom of our lower extremities. One muscle that can be really agitating for the sciatic nerve is the piriformis. Depending on your anatomy, the piriformis may overlap the sciatic nerve may go through the piriformis. There's lots of different variables there, but depending on what you are dealing with, if you have a tight piriformis, that can be something that causes sciatica as well. But it could also be something a little bit more serious, and that's when we're talking about disc herniations. What happens with a disc herniation is you've loaded the spine too much into a flexion pattern, and it sort of pushes the little jelly-like substance that's in the middle of your discs out towards the spine, and then that causes what we call nerve entrapment. The nerve entrapment sends a signal through the sciatic nerve all the way down into the foot, the lower leg, and the toes, and that causes pain. And a lot of times people feel that pain in the butt region, right around the top of the hip, and that's what's considered sciatica as well. So, depending on what might be wrong with you, whether it's muscular or if it's disc, we can go through a couple of progressions with movement to see if this is something that we can treat on our own, or if we need to go and see somebody a little bit more professional to get some imaging done. As a quick disclaimer, this is not offering medical advice. These are just things that I use on my own from my experience of dealing with sciatica related to a disc herniation, and my tips and advice on how you can modify your movement patterns to sort of treat what you're dealing with. The first thing I like to do to figure out where the sciatica might be coming from is to do what's called a repeated extension versus repeated flexion preference test. In this test, you're going to lay down on the ground and hug your knees and tuck them into your chest as far as you can and repeat the process 10 times. If this is aggravating for you, you may have an extension preference because flexion causes you pain. On the other side of things, flip around onto your belly and do 10 press-ups from the floor. This is going to extend the spine, and if you're having issues with this one as well, you may have a flexion preference. Oftentimes, people who experience sciatica tend to have an extension preference, meaning that when they hug those knees to their chest and they do those repeated flexion movements, they get pain that goes down into the hip and sometimes down into the foot. That lets us know that there may be a disc component, and the way to treat that is to do repeated extensions. So all you need to do for that is go through the process that I just showed, where you get down on the floor and you press all the way up until you've reached the top of that extension pattern. You can apply overpressure yourself by taking a deep breath in and then breathing all the way out to the bottom. That's going to allow gravity to help push you from behind and add a little bit more overpressure to the spine. When we extend repeatedly like this, it sort of helps the disc to push itself back in where it should go, and a lot of times you'll find relief from your sciatica. If you experience your sciatica symptoms from the repeated extensions, you may have what's called stenosis. And stenosis is basically just a narrowing of any of the canals that are within your spine. This can either be caused through the spinal canal itself or where the spinal nerves exit through the facet joints. In this case, you might benefit from doing repeated flexion exercises to get that to go down. All you need to do is lay down on your back, grab those knees, tuck them into your chest, repeat that at least 10 times, and then move on from there. With both of these exercises, this is something that you can do about once every hour for 10 reps and see if that starts to modify your pain and help you with dealing with those symptoms. If you guys are finding value out of today's video, please be sure to give it a like and leave me a comment in the bottom letting me know what are the things that you do to manage your sciatica if you're someone who has it. The second thing you can do for sciatica, if it's not disc related, is start to stretch the hip musculature to open it up and hopefully relieve some pressure that may be pressing down on the sciatic nerve. The first stretch that you can do from these sequences is the pigeon stretch. And I've talked about the pigeon stretch in the past. If you're interested in watching that video, just make sure you click up here on the link and see what those hip stretches look like. The pigeon stretch is great for dealing with sciatica because when you get into that flexed and externally rotated pattern, you're putting the piriformis on a stretch and you're helping to lengthen that muscle and decrease the amount of pressure that it's placing on the sciatic nerve. To perform the piriformis stretch, just get down on the floor or use a high box, move your hip into external rotation and flexion, and sort of lean your torso down as far as you can till you feel that stretch on the outside of the hip. You're getting this stretch on that piriformis and it's helping to relieve some of that pain that you're experiencing from the sciatic nerve. The third thing that you can do for your sciatica pain is actually a little bit different from the last two things, and it's paying attention to your posture. A lot of us nowadays are spending too much time sitting and working throughout the day, and we're creating so much pressure through our lumbar spine. We're losing that curve, and that's what's causing a lot of issues with tight hips and pressure through the spine. So paying attention to your posture is something that you can do once every hour to make sure that you're putting yourself in the best position possible to take care of your body. In order to fix your posture, we do what's called a slouch over correct in order to get you in the habit of finding what's wrong and then quickly fixing it. To perform the slouch over correct, all you need to do is find a chair or something that you can sit on and prop yourself up in the most upright posture as you can, engaging your core and keeping your feet flat on the floor. From here, you can slouch all the way back into your chair or your stool, allowing that bottom spine to sort of flatten out a little bit and let those shoulders round forward. This is the bad posture. This is a posture that we don't want to be stuck in, but sometimes can find ourselves in if we're not paying attention. From here, I want you to overcorrect by pinching those shoulder blades back, getting that head up nice and tall, and squeezing your core and getting that spine in a more neutral alignment. Hold this position for a couple of seconds and then slouch back down again. You repeat this process about 10 times every hour to sort of teach yourself how to get into a better posture and hopefully maintain that longer into your days so that you're not dealing with that sciatica pain anymore. So that's it, everybody. Those are my 3 strategies for dealing with sciatica, making sure that we're checking to see if it's a disc issue, working on the hip musculature, and then making sure that our posture is the best that it can be at all times to limit how much pain that we experience throughout the day. For more videos like these, you can click over here, and until next time, do good things and don't forget to move.